service.
For those who are volunteering GPs as the providers of the service, you need to give the resources to provide it properly.
He was knocked off his bike and killed by a hit-and-run driver with 42 previous convictions who was contravening 5 different bail bonds. Did the state's failure to enforce our bail laws effectively kill student Shane O'Farrell? And after today's revelation of bogus birth certs, just how widespread was the practice in adoption agencies?
Hello there, and you're very welcome to the programme. Well, first up tonight, what happens now in practical medical terms since Ireland voted to repeal the 8th Amendment on Friday? We voted yes, but who exactly is going to run the abortion services here? The statements coming from government today that appear to have cross-party consensus suggest that a regime may be up and running by January. But there are some practical questions and concerns about how the new clinical guidelines for the implementation of abortion services here will work. Here's Conor Wilson.
With last Friday's referendum to remove the 8th Amendment successfully passed, Health Minister Simon Harris today brought his proposals on legislation to Cabinet. The Dáil will sit longer over the summer to facilitate the passage of the bill, and it's hoped that the legislation providing for abortion can be in place by the end of the year. But once in place, how will abortions be provided in Ireland? How will women access these services? And what are the potential difficulties in rolling them out? The general scheme of the bill allows for unrestricted abortion up to 12 weeks, and beyond that if there is a risk to the life or health of the woman, in emergencies, or if a fatal fetal anomaly has been diagnosed. Depending on the circumstances, different services will be required.
Services should be integrated and women-centred. They should have pregnancy counselling services, they should have abortion services, they should have post-abortion medical checks, they should have post-abortion counselling, and they should provide contraceptive services for women. For most women in Ireland, they will be accessing abortion through medical abortion, which means taking abortion pills.
It's envisaged that abortions in Ireland will be mainly provided through a GP-led service. A sizable number of GPs have already indicated that as conscientious objectors, they will not be providing any abortion services. And for those who are willing, serious questions remain about how they will cope with the additional demands that providing terminations will bring with it.
It's a complex issue. It will require more than likely multiple attendances to their local practitioner if it's their GP who is rolling out this service. And that equals time that a lot of GPs are very poor in at the moment. And for single-handed GP practices, I would say the vast majority would struggle to meet that need and meet that demand.
I think it's very clear that there are enough GPs in the country who are ready, willing and able to provide this service. Over 1,500 doctors signed up to say that they were able to provide the service. The workload will not be huge, and I don't see any major difficulty with the GPs providing this service. There will need to be some training, of course, but that's the kind of thing that you would expect when there's any change.
The general scheme allows for GPs to provide abortions when they certify that in his or her reasonable opinion, formed in good faith, the pregnancy concerned has not exceeded 12 weeks. With no requirement to seek an ultrasound scan to confirm this, some GPs are concerned.
In my own opinion, I do not believe GPs or any doctor would be confident to provide the service without ultrasound and scanning, because 4 weeks of a difference between 12 and 16 can mean a huge deal to the woman and how this would work for her. If you give medication and you don't know that, you can be putting the woman's life at risk, and no one that I know of, and I certainly would not be happy to do anything that would harm my patient.
Most terminations outside the 12-week threshold will be taken care of in maternity hospitals.